Well, good morning, Vape family, and how are you this morning? It's Dave Jones here, aka Brent Stafford Jr. from TRHA, and we are actually going live here from the Chateau Laurier with the Vapors Panel Conference this morning. I'd like to introduce Cynthia Wellmeyer. She's the actual coordinator here at the Chateau for this particular conference. Would you like to say something in terms of what this conference is all about?
Yeah, we're having a panel discussion on vaping regulation today. It has some experts both internationally and nationally in Canada, and Andre Picard is moderating it, so we're really excited to see what the conversation is like.
Oh, great. So how are you able to get all these great people to speak here today?
Well, I think there's a lot of interest right now with S5 right now currently in the Senate. People have this as top of mind, so we're excited to have a conversation on this, and there are a lot of people who are stakeholders who are participating, so it should be a really good Q&A at the end as well.
Who is Health Ambassadors?
Sorry,
Who are
Health Diplomats?
Yes.
They're actually an organization that operates out of Europe and are concerned with different kinds of health issues and initiatives across the country. So they've done things like this in other parts of the world, and they're focusing on Canada for this one.
Well, thank you very much, Cynthia, and thank you for putting this on for us.
All right, thank you.
David, I have the opportunity here now to actually have David Sweeney on with us this morning. He's my co-anchor, and he is actually going to say some nice words about some stuff. David, good morning. How are you this morning?
Good morning, Dave.
We have the Vape family on today, and we're looking forward to seeing everybody and listening to this panel show this morning. So far, what we've heard is we're kind of disappointed that you weren't asked to go on the SOCI panel. Any words?
Yeah, it's hugely disappointing, especially seeing some of the testimony that was there. I think we should be doing our best to give any of the people looking at this legislation the best information they can get. What they're getting from various people who are testifying is a bunch of fear-mongering about small hypothetical risks. And I think what we're missing out on is the idea of the opportunity here. We have the potential to largely eliminate our leading cause of preventable death. What we need is some imagination rather than fear. Some people who can seize the opportunity rather than run it at ghosts and hypotheticals that have very little likelihood of ever happening. But 100 deaths a day are happening, and that's what they should be paying attention to.
You've watched the hearing so far. Okay, we're on day 3. What's your thoughts about what you've seen so far?
Well, as I say, there's a lot of information that isn't very good. There's people, I think, I think one of the ways of looking at this is that a tremendous number of Canadians are going to die not so much from sucking smoke into their lungs, but from a lack of imagination on the parts of the policymakers, the health groups that really could seize an opportunity here. I haven't seen that. I've seen a lot of stuff about everything that might go wrong. And how do we prevent that from happening? Well, then recognizing that when you do that, what you're really doing is protecting the
Okay. Well, thanks, David. We'll get back to you, and we'll actually watch the panel, and I'm sure we'll get some more comments from you later on. Okay, we'll talk to you later.
Very good.
Okay, people, I know I'm going to go public very shortly, so just wait up, okay?